Hi everyone, this is Tim, your Block 1 lecture instructor. Today we're going to cover Chapter 23, which is Administering Medications. This is Part 2, Safe Medication Administration. The learning outcomes for today will be correctly calculate drug dosages, apply measures to take to avoid medication errors, demonstrate safe medication administration using the 3 checks and the 6 rights, and you should be able to list what steps a nurse should incorporate in their practice to ensure safe medication administration and measures to take to prevent a medication error. There are approximately 7,000 deaths which occur each year in medication errors. Medication errors occur in just about 1 out of every 5 doses given in the hospital. At least 1 death each day, and 1.3 million are injured each year due to medication errors. So, nursing considerations, the medication order. Types of medication orders. There are written orders, there are automatic stop date orders, there are stat orders, there are standing orders, and there are PRN orders. Communication of orders. There are handwritten, pre-printed, orally, and telephone orders. Components of the medication order prescription. They'll have the patient's full name, they'll have a date and time, name of medication, dosage size, frequency, and number of doses. They'll have route of administration, the printed name and signature of the prescriber, and it'll also include a relevant credential and the legal registration number. So as you can see in this script, Michelle Graves, RN, family nurse practitioner, wrote a prescription for a patient, and it has their first and last name, and it has the date that the actual script was written. The prescription also has the name of the medication, which is lisinopril, and they wrote it for 20 milligrams. The pharmacy is to dispense 90 of those pills, and the patient is to take 1 tablet by mouth every morning. And the refill is times 3. And then Michelle Graves actually signed the prescription. Sometimes the nurse practitioner or the doctor will also add some numbers after their name, and that's usually for narcotic prescriptions. So, medication administration safety, there are 3 checks. One, you'll pull the medication, and you'll check the medication label against the medication administration record, or also known as the MAR. And then the placing for transport or after pouring, and you'll verify the label against the MAR. And at the bedside, you'll also, or when you're returning the medication, you'll also check the medication again. So you'll check it the first time when you pull it out of the Pyxis or wherever the medication is being stored. You'll check it again when you're actually transporting it to the patient's room. You would also check the medication inside the room with the patient, and again when you actually return it. So for me, it's a matter of just checking and checking and checking and checking over again, and you're really checking these against the MARS. For hospitals, we now have machines, or where I work at Scottsdale, we actually have a computer in every room. You actually scan the patient's armband, and then you scan the medication. So you're going to check it when you pull out of the Pyxis, you'll check it again when you're in the room, and you'll check it against the MAR when you're scanning it, and so you're really checking it over and over again. And this is really, like I said, just really making sure that you have the right medication for the right patient. All right, so for this slide, it's 6 rights. You want to make sure you have the right drug, the right patient, the right dose, the right time, the right route, and the right documentation. So again, as I mentioned earlier, you're going to make sure that you have the right drug for that patient. You're going to go in the room, you're going to scan the patient and the drug. Those two will match up. Those will also coincide with the actual medication sheet or the computer to make sure they have the right dose. It'll also flag you. It'll tell you whether or not you're giving the medication too early or too late, and it'll make sure that you're giving it on time and the right route. Is it given orally? Is it given sub-Q, IM, rectally? And then when you're done, you're going to save it all, and it's going to be the correct documentation. So other rights to look for is the right reason, right to know, and the right to refuse. So for your patient, you will go in the room and you'll make sure that you're giving the right medication to them, and you want to know why you're giving it to them, whether or not their blood pressure is too high, whether or not their blood sugar is too high. When you're giving medications, you want to know why you're giving it to them. And your patient, you should tell them why you're giving it to them. They have a right to know what you're giving them and for what reason. And they also have the right to refuse. I've had patients that have gone in the room to give them a stool softener because that's what's ordered, and then they tell me that they've had diarrhea for the last 3 days, and people keep giving them stool softeners, and they have the right to ask for you not to give it to them. So avoid medication errors. Arrive to work well rested and undistracted. Use your 6 rights. Calculate doses carefully. Double check with a second RN. Watch for drugs with similar names. Watch for clients with the same last names. Follow safety guidelines and standards. Never take shortcuts, and always use your critical thinking skills. So, um, back to the top, you want to arrive to work well rested and undistracted. You want to be well rested. You don't want to make errors based on being tired, and being distracted is one of those possibilities of making an error. Where I work at the Pyxis, we have a rug that tells the person behind you that it's a quiet area, so that way people are not distracting you and asking you a million questions. Um, and again, when you're going from there to the room, you don't want to be distracted, and while you're giving the medication, you don't want to be distracted. Again, you'll use your 6 rights. And then as far as calculating the doses, for the most part, you're going to make sure you have the right medication and the right dosage. And there are some medications that you want to verify with the second RN. One of them is insulin. Sometimes the hospitals will also have Coumadin be checked with the second RN to make sure it's the right route and the right patient and the right lab draw. You want to watch for drugs that have similar names. There are several drugs that sound alike or look alike, and you accidentally pull them out, and you're in a hurry, and you're just busy, and that causes medication error. Uh, Watch for patients with the same last name. Where I work, if you have the same last name as somebody else, usually they'll move you off the floor and put you somewhere else. You also want to follow the safety guidelines and standards. Like I said, just following the 6 rights and making sure you know what you're giving and why you're giving it, and don't take shortcuts. For the most part, follow your 6 rights, do your job well, and there shouldn't be any errors. And use your critical thinking skills. If a patient tells you they've had diarrhea for 3 days, you don't give them a stool softener. It's just that simple. All right, so you want to clarify unfamiliar drug names and dosages or illegible orders. If you don't know what it is, if you can't read the order, or you're just confused, ask people. Call the doctor. Make sure that you are getting the right order for the right patient, and it's for them. Avoid abbreviations. They've come out the list of medication abbreviations that you can use, or even dosage abbreviations, um, and just be very specific. Know and use your resources. Again, ask your coworkers, ask your supervisors. Check drug guidebooks, Google, the medication. Know what you're giving, how you're supposed to give it, and what the normal dosage range is. Keep up with changes in medication orders. You want to check the medication order periodically throughout the day. So if something gets changed, you're not giving the same thing, which may be more than what they should have gotten. And listen to your patients. If they don't want the medication, they don't want it. If they tell you signs and symptoms of something different, then kind of follow along with that, and listen to them, and make sure you're giving the right medication for the right problems. Question any part of a drug order that you do not feel comfortable about giving. Again, call your doctor, call your pharmacy. If it doesn't look right, it probably isn't. And if it is, make sure you've contacted with the right people to make sure that it is. Check expiration dates of meds. For the most part, pharmacy does a pretty good job about making sure that medications don't expire, but if you get in the habit, eventually it's just second nature. And then give only what you have prepared. So if you're going to give something liquid, you pour it out, measure it, and take with you what you just poured and made sure it's the correct dosage. You don't need all the extra stuff. That just is a possibility of either giving too much or a medication error. What should I do if I commit a medication error? Immediately assess the patient's vital signs and physical status, report findings to the primary care provider, and notify the nurse manager of your unit and report that event surrounding the event. Check with your institution for agency-specific policies regarding incident reporting. Um, we've all made medication errors. As a LPN, before I was an RN, actually gave or hung a bag of vancomycin to the wrong patient, and it wasn't until it was hung that I realized that it was the wrong medication, the wrong patient. Again, if I would have followed my 6 rights, I would have not made the medication error, but things happen. You get busy, and you just get careless. And but once I realized that I'd done it, I did their vital signs. I checked them and I did a reassessment, making sure there's no problems. I called the doctor and told him what I had done, and then I told my nurse manager. And about 6 weeks later, they do a variance on it. So it basically is not necessarily a write-up or anything punitive, but is to pretty much kind of assess and do an investigation as far as why it had happened, and to see if there's more training that need to be done in order to prevent this from happening again. So if I had followed the 6 rights, that wouldn't have happened. And luckily, nothing did happen. So for correctly thinking, you have checked the medication record for Margaret Marks and prepared her next dose of antibiotic for intravenous administration. The EMR also indicates that she is receiving morphine for pain and that her last dose was given an hour ago. When you enter the room, you find her apparently sleeping. You're not able to awaken her to verify her identity. What do you suspect is happening, and how should you respond? Well, let's see here. You give her morphine an hour ago, and you enter the room to reassess her, which is what you should do when you give IV medication, and you can't seem to awake her. I suspect what is happening is that the 1 milligram or the morphine that we had given was probably a little bit too much for her. I would probably reassess her. I would do vital signs and check her oxygen saturation and go from there.